My name is Farid Kazem. I'm a plastic surgeon. I have more than 28 years experience. So I started doing plastic surgery in general terms, so it was both reconstructive and aesthetics. And then as I grew older I've done almost everything, I decided that aesthetics is where I should focus my energy and time. So from about 2001, 2002, I started my own private clinic, and I chose to do only aesthetics. So that is actually what we today also still doing. We're doing aesthetic surgery, but I also noticed about 10 to 15 years ago that there is a shift going on in the aesthetic market from surgical to non-surgical. So I embraced that, and I like technology. So almost 20 years ago even, I was interested in lasers. I was one of the first plastic surgeons that started doing lasers, and that was at that time to remove tattoos. And actually a lot of my colleagues were laughing at me, so why are you doing that? This is something what dermatologists should be doing. But I liked the technology, and I thought this is something that will evolve, so why not? I can have it also incorporated into my practice. And from that moment on, actually, we are still doing lasers, of course not for tattoo removal, because I think that market is really, in my opinion, ruined, because now other tattoo parlors and aesthetic beauty salons are also doing that. So I am not interested in going into that direction. But anyway, so going on, we really embrace the non-surgical market as well. We've introduced a lot of non-surgical procedures like thermage, like cool sculpting, lasers, clear and brilliant, all of that. And when it comes to HydraFacial, I was really intrigued when I've seen what the HydraFacial is all about, and I liked the technology. And knowing Clint Carnell as well as the CEO of the company made me more enthusiastic, and actually to actively get in contact with them and discuss options. And I'm very happy to be their KOL and to have the HydraFacial Elite in our clinic, and being one of the first installments actually in the Benelux to have that the new machine.
Yeah, we've seen that you are actually quite successful at providing the HydraFacial, which is not that easy for the medical market because they're mainly medical oriented. Yes. Like you discussed, you saw the market shift from medical to more aesthetical. What are the reasons why you think that the shift took place or is taking place at the moment?
Well, the shift is basically, I would call it from invasive to non-invasive. And I think that the shift is two reasons. One is that the customers for today, we live in a different world. The world is moving very fast. There is a lot of things going on. And before COVID, we were traveling a lot. So people didn't have the time to stay at home, have a long period of downtime. So people wanted to look good. They wanted to pay for it, but they wanted an instant solution that will take 1 or 2 days, maybe maximum, but not more than that. And on the other hand, the technology evolved a lot. So there is a lot of new technology out there that makes it possible to do non-invasive procedures to make you look good and stay in shape and stay good for as long as possible. So these two reasons made it the shift much more faster and smoother. And it's a choice. If I look at my profession and to colleagues of mine, it's a choice. Do you want to stay with what you know, which is the surgical part, or do you want to go with the movement of the industry towards the non-invasive and have both? Because we can do both. And that's a great advantage.
And you're not actually performing those treatments yourself. You're still doing your surgical part,
Yes.
but it's that you can build a team around you that is performing those treatments for you. How has that impacted your business side of the clinic?
Well, I think it did a lot of good things. It brought totally new customers to the practice because, for instance, with the HydraFacial, I mean, it's a feel-good treatment. So there's nothing really of a taboo or scary, because, I mean, when you talk about surgery, I mean, we are surgeons, we think it's the normal thing to do. But for a normal person, cutting is not something that they say, hooray, we want to do that, unless it is really necessary. So it's always, there is some kind of scary part of it. Even if you make an animation, even if you make it easy so that you don't see any blood or anything like that, we think we're doing them something that they will understand. But no, to the personal, in their mindset, it's still scary. Although they want it, but it's still scary. When you talk about HydraFacial, everybody's happy because they know there's nothing scary about it. It's a feel-good treatment. So that kind of people who would normally say, well, no, we don't have to go to the clinic because they only do surgeries or they do lasers, which are also a bit scary. They come now here just to have the feel-good treatment, but at the same time, they are here and they get to know us and they get to be comfortable with us. So if they need anything more than that, they are much more willing to do that here than doing it somewhere else. And I think that's a really added benefit because it's attracting other kind of clients that we normally wouldn't see.
Mm-hmm. And have you seen that in the practical part as well? Because you're now working with HydraFacial for, let's say, a year already.
Yes.
Have you seen that shift, that transformation with the patients?
Yes, and what I also like is that it gives us the opportunity to give our existing clients something extra. I call it the added value. Giving something as a present to tell them, okay, where you're doing facial treatment here, like a thermage or whatever, skin tightening, whatever, I'm going to give you something extra to feel even better, to feel good. I will give you as a present a HydraFacial treatment. And I can tell you almost everybody that does the HydraFacial treatment will rebook more treatment. So I'm giving something, but I'm getting a lot in return as well. And that is also a part of the business.
Yeah, it's sowing and reaping in the correct fields.
Exactly.
Yeah.
You give, you get in return.
Yeah. Okay, great. It's also, HydraFacial is a feel-good treatment, but of course it also delivers the results of hydration, more healthy skin. How has it changed the skin of the patient in order for other treatments to perform more effectively or quicker?
Well, I like the combination a lot because any treatment on skin tightening or skin rejuvenation with other treatments, I think HydraFacial has a lot of added benefit because it makes the skin in a better condition to start with, and it can keep the effect that we have done as long as possible. So I think it's like a very nice symbiosis between both, and I like that. So I like to package it as well in our face treatments. So I always would recommend to have both entities because I think they have a lot of added benefit together. Also, it enhances the way we present our skincare products. We have developed our own skincare products, and I think it has also improved the sale and the introduction of our skincare products to our customers. And that is also a nice added value to the whole thing. Yeah.
Yeah, it's an interesting thing to hear because HydraFacial always positions itself between skin correction treatments and skin care at home, and they're the bridge in between, but you have actually seen that happen in the practice.
Yes, absolutely, absolutely. And also I like everybody, when we talk about HydraFacial, we talk about HydraFacial for the face, but there are, of course, other things. I mean, these just the Keravive, which I really love. It is something that was introduced, I think, a year ago, or maybe less than a year ago. And I was also interested in it because, as you see, I have some thinner spots on the top of my head. So I decided, well, let's try that. And it's difficult to see for yourself all the time, but when I look at, I mean, all the team members here, they said immediately after 6 weeks, we can see the difference. We can see that there is less thinning of hair and there is more coverage. So yes, and now it brings also a lot of male clients to the practice who are interested to have the Keravive treatments.
Yeah, it's an incredible product.
Yes.
I had no hair, and look at me now. No, but it's a skin health program with HydraFacial, and now you have a scalp health program. Yeah. So you see that they're exploiting their health regimen on how can we treat larger areas. Yeah. How is the area body doing in the clinic? Is there a lot of questions
be honest,
about it?
Yes, there is some questions. I haven't done. We haven't done that yet, but that is something that I'm really looking into, also combining with other treatments, like when we're doing cellulite treatments or things like that. We do standardized. Actually, when we do face, we do the hands as well. And our clients really love that because it gives them an added value, because I mean they are paying for the face, but they are getting their hands as well, and they can feel the difference immediately. And I think there are not so many treatments specifically for the hands, so I think the combination is also very nice.
Yeah, which creates the opportunity to sell more different kinds of treatments. Exactly. Let's say fillers or anything else. Yes. Yeah. Yeah. Okay, great.